Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Our speaker today is Dr. Rosalind Ramsey Goldman, Professor of Medicine at the Sullivan Arthritis Research Society and Medical Director for the Clinical Research Unit at Northwestern University in Chicago. Today, she'll be discussing men and lupus. I'd now like to turn it over to Dr. Ramsey Goldman and thank her for joining us.
Thank you for inviting me to speak about lupus in men. I thought I would start out with some questions, and that would be, how common is lupus in men? Well, lupus can occur in anyone, men or women, young and old, but most often in women between the ages of 15 and 45. Lupus is also present in all racial and ethnic groups. While lupus affects women disproportionately 9 times more than men between the ages of 15 and 45, at the younger and older age ranges, women get lupus 2 to 3 times more often than men. Overall, men represent approximately 10% of all patients with lupus, and this means that for every 100 individuals with lupus, 10 will be men. One observation that is consistent across all studies is that underrepresented populations are more likely to get lupus, whether you are a man or a woman. The next question I would like to address is the following. Are there differences between how lupus affects men and women? Many groups around the world have tried to tackle this question with mixed answers. Differences in location of the study, duration of disease, type of practice setting, whether this is a new diagnosis or an established one, the age when the study was reported, as well as the racial and ethnic background must all be considered when one is reviewing these reports. The most consistent observations find that men may have an increased risk of having low blood counts, cardiovascular complications such as heart attacks, unexplained fever and weight loss, and in some studies, men may be older than women at the time of diagnosis. Men are also more likely to have antiphospholipid antibodies, which increase the risk of blood clots, and they may have more renal or kidney disease and serositis, which includes pleurisy or pericarditis, which the man feels as chest pain when taking a deep breath. In contrast, women with lupus seem to have more arthritis, alopecia or hair loss, sun sensitivity, malar rash, oral ulcers, and Raynaud's phenomenon when the hands turn colors when exposed to the cold. More research is needed to refine these observations and help physicians guide their ability to diagnose and treat lupus in both men and women. Next, I would like to address the following question. Are lupus symptoms more severe in men? Again, there is no consensus on the answer to this question. There are studies in some academic centers that document more severe disease, especially kidney disease in men, that then goes on to kidney failure when the individual needs dialysis or a kidney transplant. However, there are other studies which did not find that men had more kidney disease from lupus when they're compared to women. There is also a concern that men might have an increased risk of death from lupus compared to women, but this also is not found in all studies. Furthermore, those individuals of Hispanic ethnicity may actually have a lower risk of dying from lupus or consequences of the disease. It is very clear that more research is needed to refine these observations to help physicians guide their ability to diagnose and treat lupus in men and women. What are the most common concerns among my patients with lupus who are men? There are 2 issues that I would like to discuss. The first relates to support. Men with lupus are concerned that they have a woman's disease, and this is also the reaction they get when they interact with their social network of family, friends, and colleagues. Family members and friends may not understand the ups and downs of the disease or the impact of treatment on how a man might feel each day. Work accommodations, which may be necessary, are sometimes hard for men to receive since the workplace does not understand that a man can get lupus, nor do they understand the impact of lupus and the treatments on job requirements, ranging from the following to needing more flexible hours, working from home, limiting physical tasks, just to name a few. Men and women, for that matter, both worry about their benefits, including health insurance, and the ramifications of not working and what that might mean for their loved ones as well as themselves. Support groups exist. The Brotherhood of the Wolf is a male-only support group network, and if you are a man with lupus, you can check out if this support group is available to you in your area, or maybe you can start your own. Information about this network of support groups is on the Lupus Foundation of America website. The second concern I would like to discuss is the issue of fertility. There are numerous studies on reproductive health in lupus for women, but this is rarely addressed for men. Some of what we know comes from the cancer literature, especially when it comes to counseling if chemotherapy is needed to control lupus symptoms in men. The few studies that address this issue in lupus find that men receiving cyclophosphamide may have lower levels of the active form of the male hormone called testosterone, and that men who have received this treatment may also have fewer and less active sperm, all of which could impact fertility in a negative way. These observations are similar to what is seen in men with cancer who have received this same medication. The good news is that there is a strategy to preserve fertility in men by banking or freezing sperm prior to the use of these medications. If your doctor is considering this as a treatment option for lupus, you should definitely discuss this option with your physician. A man may also be a candidate for testosterone replacement if the deficiency is noted. A referral to a urologist is recommended to see if the sperm can be banked or frozen, or if receiving testosterone replacement is appropriate. Thank you.
Thank you so much, Dr. Ramsey Goldman, for joining us today and sharing such valuable information and answering questions about how lupus affects men. For those listening in, we invite you to check out next month's presentation on complementary and alternative medicine. If you would like to learn more about living well with lupus, you can find additional resources on the National Resource Center for Lupus, or you can call one of our health educators at 1-800-558-0121. If you would like to connect with others who are impacted by lupus, including men, check out our online community, Lupus Connect, where you can talk with others, find emotional support, and discuss practical insights for coping with the daily challenges of lupus. Thank you, and have a wonderful day.